Thanks, Nelly. Hi, everyone. My name is Arnav Sankranti, and I'll be your host for today. Thank you so much for spending your Saturday at the 2021 Medical Humanities Symposium. Before we start, I would like to announce a few Zoom housekeeping points. All the attendees are in the listener mode for this webinar. If you have any questions for the speakers, please type them up in the Q&A box and make sure to specify who the question is for. At the end of the two sessions, the speakers will address all of your questions in a panel setting. We're really excited to hear from the many perspectives our speakers will engage with. Our first speaker is Dr. Kirsten Ostherr, who is the faculty advisor for the Medical Humanities Club, as well as the director of the Rice Medical Humanities Program. Dr. Ostherr is the Gladys Louise Fox Professor of English at Rice, where she is a media scholar, health researcher, and technology analyst. Her research on trust and privacy in digital health ecosystems has been featured in Slate, The Washington Post, Big Data and Society, and Catalyst. She has recently published research on medical humanities and artificial intelligence in the Journal of Medical Humanities, and her writing on COVID-19 has been featured in Inside Higher Ed and is forthcoming in American literature. She is currently leading a multidisciplinary project called Translational Humanities for Public Health that will identify humanities-based and humanities-inspired responses to the COVID-19 pandemic to document and help others build upon these creative efforts. The title of our talk today is Translational Humanities for Public Health. Welcome, Dr. Ostherr. We're glad to have you speak today, and I think you're going to give a few introductory words.
Yes, okay, thank you very much. I am delighted to be here, and thank you all for joining us today. I wanted to just take a couple of minutes to talk about the club and its importance to medical humanities at Rice. We founded the minor in medical humanities about 5 years ago. At the end of this academic year, that will be the end of our 5th year. And a lot of the activity and energy that led to the formation of the minor really had to do with the work of the students and the student club and their desire to have, to be able to kind of formalize the work they're doing in many classes that already existed, but that weren't grouped into the form of a minor that they could actually get a degree in. So the club is a really important part of the minor as a whole. In addition to this annual symposium, which they do every year and do a great job with, they have events throughout the year where they bring in speakers for coffee chats or what used to be pizza nights, when we could do these sorts of things in person. And they would host a variety of events where an outside speaker would talk and have discussions with the students, or they would all read something together and discuss it. And this is just a really great way of doing the work of the club and the work of the program as a whole, which is to really expand in a multidisciplinary way the meaning of medicine and health, to understand the ways that factors like religion and spirituality, or history, or aesthetics and visual representation and narratives, how all of those things shape the experiences that we have of health and illness. So thank you again for inviting me. I'm really pleased to be here, and I'm happy to take a little time to present to you this ongoing work that I have on translational humanities for public health. So I want to just start with a couple comments about where this project came from, which has to do with something I observed early on in the pandemic. I ask here, how have technologically mediated data shaped the visualization of the pandemic? And that's because one of the things that I noticed early on was the ways in which we, as a society and really globally, but especially in the United States, were taking a very, what I would call a techno-scientific approach to responding to the pandemic. One example of this is, you may recall from about a year ago, the early focus on ventilators and ventilator shortages in particular. And you may recall lots of headlines like this one in the New York Times, which spurred not only companies like the one you see here, where a manufacturer started ramping up its ventilator production, but also companies that didn't normally make ventilators started making them. And students, like our students in engineering here at Rice, started working on do-it-yourself ventilator assemblies, basically to try to address this massive shortage. This is both extremely important and valuable work, and also work that prompted me to ask, what is this framework orienting our attention to, and what is it leaving out? So the focus on technological interventions and on representing the pandemic through data, all the data visualizations that we saw perpetually. One of the things that we learned a few months in was that although it made a lot of sense in a way that we would go towards ventilators as a potential solution, that they actually oftentimes cause more harm than good. And that though it made sense to imagine a kind of technological intervention that could help us get out of this problem, it was quickly apparent that the problem was far more complex than a single technology could resolve. Similarly, with the data visualizations that we were seeing, it became clear before too long, and it was clear early on to those researchers who do kind of critical data studies and think about how, when we represent reality through data, what aspects of that are left out. It became apparent that our data also was very flawed, in the sense that we were missing a lot of data. Insufficient testing led to insufficient testing data. Uneven access to testing led to misrepresentations of the scope of the pandemic. Similarly, it's kind of hard to perhaps even remember or realize this now, but back in April also, the scholar Ibram X. Kendi commented in The Atlantic about the seeming racial bias of the pandemic as it was playing out. But he talked about it as a seeming kind of problem, because actually there was very little data being collected at that time and reported about race and ethnicity. And in fact, that is still missing from a lot of the CDC data on the overall incidence of COVID across the country.
Dr. Ostherr, sorry
Yes.
to interrupt. I don't think we can see your screen.
Oh no, oh my gosh. Okay. All right, oh goodness, okay. So sorry about that. Let me do this again. And can you see it now?
Yeah, we can see it now.
Oh, I'm so sorry about that. All right, let me just show you quickly a couple of the images, but I'm not going to take the full time to go through this. So I was just showing you some images of the ventilators and the data visualizations. And this is where we were. Okay, so I wanted to point out just through this opening that data is always socio-technical, and technology is always socio-technical, meaning that you always have to think about the social context in which technologies are produced and used, and same with the production of data. Data are always missing and messy, and both of these observations made it really clear to me early on that medical and health humanities really needed to focus, when thinking about the pandemic, on the role of technology and data in addition to many of the other dimensions of the pandemic. So one conclusion that I've reached in the research that I've been doing throughout the pandemic is that by representing COVID through technologically mediated data, we end up with what I would call spectacles of visualization that focus on techno-scientific interventions, and as a result, erase human narratives of suffering. And I want to show you what I mean by that by talking about the translational humanities approaches that I think help correct this problem. So the question is, what is lost from the pandemic response when translational humanities contributions are missing? I was really struck by a blog post, actually, which was then produced in a scientific journal by Ali Al-Khatib, who is a medical anthropologist and software developer, who commented that the spaces and the people we should be most concerned for and paying the most attention to won't show up in a digital contact tracing system like any of the ones proposed so far. And he argued we should care that the gaps in our knowledge will be consequential and non-random, sabotaging our efforts to understand what's actually going on in the world and undermining our response. So some examples of what he means by that include, so I mentioned already how we had really lagging data on racial and ethnic incidents of COVID. Similarly, for the first several months of the pandemic, Native Americans were not even being tagged as Native Americans in the case reports that were being produced by public health organizations and sent to the CDC for compilation. And all of this really, I think that we really have to see this in the context of long histories of mistrust of medical institutions and institutions, surveillance institutions such as police, especially among communities that have already been harmed and have been vulnerable to those kinds of harms for a long time, right? So I think that it was clear to me early on that there was an obvious connection between these kinds of histories and the kinds of suffering that were occurring in the pandemic and that were going to occur and be really exacerbated by it, that were becoming more visible. But it was also clear to me that many of the approaches to data visualization that we were seeing really left these narratives out. And this was what led me to really think about the importance of humanities approaches that are historical, that are narrative, that are contextual, and that have rich roots in cultural traditions that are not only about making sure people are seen and understood in appropriate forms, but also play a really important role in healing. So, and this also speaks to many of the efforts that have gone into intervening in the pandemic, where, for example, in this piece, the scholar who was part of an ethics panel at Johns Hopkins University argued that trust is really central, and the trust of Black communities is really lacking when it comes to approaches like health surveillance. And that is a real problem that we need to address head on, right? So that can't be kind of a lagging thing that we figure out at the end of the pandemic. It has to be something that is actually interwoven into the policies of the pandemic. So when we think about all of these kinds of technological approaches to intervening in the pandemic, this quote really stood out to me by Ramesh Raskar at the MIT Media Lab, where he was arguing, and they were trying to develop a digital contact tracing tool. And he commented, how do you create a solution that doesn't end up being a tool of the surveillance state? That's the biggest challenge for us. And so what this led me to do, along with a really great team of undergraduates and graduate students and postdocs and faculty colleagues here at Rice, was to apply for some funds from the Rice COVID Research Fund, which we received to start a project on translational humanities approaches to the pandemic. And this was really driven by my observation of all of these gaps that I was already seeing, as well as responses that I saw as really emerging directly out of humanities approaches, but that I thought should be more central to the policy approaches to the pandemic from early on. So one example is an Asian American studies scholar who created a database basically documenting all of the xenophobic attacks that were happening against Asian and Asian American people in the United States due to the xenophobic language that was being used about the pandemic. Along different lines, the United Nations early on made a call for creatives from all over the world to try to ask for people to contribute their own artwork that would be culturally rooted and appropriate to communicate the messages they were trying to communicate about the pandemic. So this is one example on this slide. Here's another one. These are from Brazil, Belgium, and Panama. They're from all over the world, though. I also wrote in the Washington Post about the ways that the racist contagion narratives that we were getting about COVID early on were part of a very long history of public health narratives that we really need to critique and reinvent. Similarly, there were articles in places like Scientific American that were noting what we have learned from historians' analyses of past pandemics, suggesting that things like social distancing measures, communication, and international cooperation are the most effective methods to slow COVID-19. I was really struck by that because, of course, those are things that are readily available. They don't require technology or massive infrastructure. They just require putting the right priorities in place as far as how you respond to the pandemic. So I've seen a lot of what is sometimes called policy relevant humanities. The World Health Organization has had a series ongoing since 2004 that adapts histories of global health to policymakers so that they can learn from those insights. And philosophers like Kwame Anthony Appiah have written about the ways that some of the moral failures of our society are come through in places like prisons, factory farms, and nursing homes, which I was really struck by as this argument kind of from 10 years ago resurfaced in early in the pandemic, because these were places where there were hotspots of outbreaks. And so in a way, what you can see when you look at data from those outbreaks is an expression of our societal values. So it's a different way of thinking about the meaning of data in this context. So there are other projects that are also doing this kind of work, like the Urban Systems Lab at the New School in New York, that's bringing together the ways that racial disparities in particular make people and communities especially vulnerable to both climate change and to COVID-19. UCLA has a project that's about COVID in the prison systems. And two scholars who published a book recently called Data Feminism adapted part of that book for a piece that came out in Big Data and Society that was specifically orienting it towards data practice in the context of the pandemic. And one of the things they were pointing out is that we need to understand the emotional, the affective, and the social and cultural dimensions of data in order to represent and visualize data in a responsible way that takes account for the disproportionate impacts of COVID on specific populations. Two projects that are taking a similar approach to that, specifically for data around the impact on African-American communities, are COVID Black at Purdue and Data for Black Lives, which is a consortium. And they write about how data systems have potential to empower communities of color, but that history tells a different story in which that data is often used as an instrument of oppression. So I want to close by just noting that in some countries around the world, humanities, scholars, and methods are much more at the forefront of policy approaches to the pandemic, Germany being one of them that was written about in this piece here. And I also want to point out that some of the things that I've been noting that are missing and that should be part of the pandemic response, the kinds of personal and community narratives that reframe the data or that fill in the missing data. This is just building on arguments that have been made in the field of health humanities for a long time around the importance of narrative medicine, which extends to the ways we think about narratives that are embedded within big data sets and that are interpreted oftentimes by AI algorithms. And so I would argue, based on this overview, that data tracking and technology development are really in need of humanist intervention, and therefore we need translational humanities for social justice and health equity. And so that led to this collaborative effort to first develop a survey that we used to gather information and are still using to gather information from people all over the world who are doing projects that we consider to be translational humanities. They're taking humanities methods and knowledge and using it to develop some kind of intervention into the pandemic itself. So we've gotten almost 260 responses so far, and we're developing a public-facing website where people will be able to see and search different approaches to translational humanities efforts, and also understand how they connect to people's training in different kinds of humanities fields. And we're really excited about this project. I have the QR code here, but it's also just available on Medical Futures Lab website. And I would be very happy for any of you to participate if you're involved in projects or know of faculty that you might work with who are. So thank you very much for your attention, and I will look forward to discussing more when it's time for the Q&A. Thank you.